Hello students. So today we'll be talking about the blood supply to our head and neck region. And the blood plays an important role in providing our cells with nutrients and oxygen, and also carrying deoxygenated blood and waste products back to our lungs. And it also plays an important role in our immunity because our immune cells, our T cells and B cells, travel through our body, through our blood, and also through our lymph system. So let's do an overview of our circulatory system, and we can kind of think of the circulatory system as two circuits. And what I mean by that is we have a systemic circuit and a pulmonary circuit. So we have a circuit that goes throughout the whole body, like the heart to the rest of the body, but then we also have a circuit that goes from the heart to the lungs. So veins carry blood to our heart, deoxygenated blood to our heart, and arteries carry blood away from our heart, our oxygenated blood. Coronary arteries supply the heart with blood. And in general, veins run with arteries, like they're together, like parallel, and they often have the same name. And sometimes it even has the same name as a nerve, like you have an inferior alveolar nerve, an inferior alveolar artery, and an inferior alveolar vein. The one exception to this, of course, occurs in our head and neck region, in our neck region. It's the jugular vein, which runs alongside the carotid artery. And it's the carotid artery that brings blood to our head and neck region, the internal carotid to the brain, and the external carotid to the teeth and areas outside the brain. And so when I say internal, external, I almost think of it like superficial and deep. The external carotid is sort of more superficial, closer to the front of our neck region. And the internal carotid is deeper, closer to our spinal column. And that kind of makes sense, doesn't it? That the internal, the deeper one, goes up to our brain, and the external one, or the more superficial one, goes to our teeth and the areas outside of our brain. So some key words for you to know is artery, which carries blood away from the heart, oxygenated blood. Arterial, which is a smaller artery. So it might go from an artery to an arterial, and those branch off and connect with a capillary bed. And it connects with a capillary bed that also includes a venule, which is a smaller vein that drains the capillaries, and then it will progress to a vein, which is a bigger, has a wider lumen or an opening inside, just like the artery. It's bigger than a venule. So it kind of goes from an oxygenated, let's look at it. Oxygenated blood will leave the heart through the aorta. It will travel through arteries into an arteriole. It will come to a capillary bed where there'll be an exchange. In this capillary bed, the venule is kind of attached to the same, so it goes arterial, capillary bed, venule. So the oxygenated blood leaves the aorta, travels through the artery into a smaller arteriole, gets to the capillary bed where the oxygenated blood nourishes our cells, and then the cells will give up their waste and their deoxygenated blood, which will then travel through the venous side of the capillary bed into a venule, and then finally a vein. And if it's in our lungs, it will eventually, if it's in our legs, it will eventually end up at the inferior vena cava, back to be oxygenated again through our lungs. Now, a venous sinus is a blood-filled space between two layers of tissue. All right, so those are some of our key words to know, and we're going to go on to another key word, anastomosis. Ooh, what is that? Let's see. an area where branches of vessels from one area open into branches of vessels of a similar size from another area. The head, in fact, there are a few places in our body. We have anastomoses in our hands. We have them in our gut. We have a lot of them. The veins have several areas of anastomosis. Now, when it's working well, it's a good thing, right? Because you don't want to only have one source of blood getting to specific areas, and especially like to our head and our brain. So sometimes it's a good thing to have alternative sources or routes to oxygenate or get blood to areas. Unfortunately, when it's not working well, it can lead to a spread of infection because these areas communicate with one another. And anastomosis also brings intracranial and extracranial blood together. So there's lots of places in the head and neck that have these anastomoses. It's another reason why when you have a head injury, or if you've ever banged your head or cut your head, it bleeds like crazy because there's all these kind of vessels communicating with one another. So the brain and the head are highly perfused with blood. So when it's working well, it's a good thing. We want different routes to get to different areas. But when it's not working well, sometimes infection can be spread, and it can be spread from the oral cavity to the brain. Now, plexus. So the plexus, we've talked about this a little bit before. In the plexus here, if we see it, it's right here, okay? And although right here, the muscle is kind of covering, right? This is part of the buccinator, masseter. They've cut some of the muscles away. But you can see there's lots of little small vessels come together, and we called this area before a blood highway. But what it's actually known as is the pterygoid venous plexus, and we have different plexi or plexuses within our body, and it creates a highly vascularized area. So this area, if you introduce a needle into this area, or if it's traumatized, it can bleed quite a bit. And that is what a plexus is. Now, our arterial blood supply. The aorta, so the aorta exits from the left ventricle of the heart. It's returned nice and oxygenated from the lungs through the pulmonary vein. Pulmonary vein is the only vein in our body that carries oxygenated blood, and the pulmonary artery is the only artery in our body that carries deoxygenated blood. And this is the pulmonary circuit where the heart is sending deoxygenated blood to the lungs. The lungs and its capillary beds fills the blood with oxygen, and it sends it back to the heart, and it will exit from the left ventricle of the heart through the aorta. We have the ascending aorta, the arch of aorta, and the descending aorta. And the aorta gives off three branches. It gives off right here the left common carotid artery. It also gives off the left subclavian artery and the brachiocephalic artery. And then the brachiocephalic splits into the right common carotid right here and the right subclavian. So if you notice, the carotids, the left and right carotids, are a little different. The left common carotid artery comes right off the aorta. The right common carotid starts as the brachiocephalic and then branches into the right common carotid. So that's just a tiny difference there. Now, our carotid artery can be palpated. We kind of feel underneath here, down below the angle of the mandible and a little forward. And it's our most reliable arterial pulse. This is our emergency pulse. In an emergency situation, we'll be checking for the carotid pulse. So the common carotid arteries, the left and the right, they supply almost all blood to our head and neck. So these are pretty important arteries. These are the arteries that they're looking at when someone has coronary artery disease. They're checking to see if these common carotids within the neck are getting narrow, and so the person might be having some transient ischemic attacks of the brain. They check common carotid arteries a lot using a stethoscope. So we like to keep these nice and clear and nice and wide because they are sending almost all of our blood to our head and neck. And they're deep to the SCM, our sternocleidomastoid muscle. And at the level of the thyroid cartilage, right about at the thyroid, it splits into an external carotid artery and an internal carotid artery. And the external carotid artery, the one that's a little bit more superficial, supplies our teeth and areas outside of our brain. And the internal carotid artery supplies our brain. Now, the external carotid artery has 8 branches. 3 of them are directed anteriorly: the superior thyroid, the lingual artery, and the facial artery. The maxillary and the superficial temporal are in the head. And 3 of the branches of the external carotid are directed posteriorly: the ascending pharyngeal, the occipital, and the posterior auricular. And when you think about it, when you think about the names, it does kind of make sense. You know, towards the pharynx, towards the occipital, behind the ear, that those branches will be going back or posterior. Superior thyroid, lingual, which is tongue, and facial, towards the face, those will be coming forward or anteriorly. And then the maxillary and the superficial temporal will be going right into the head. Now the internal carotid, so here's the common carotid, and here's the external carotid, and the internal carotid. The internal carotid is heading up to nourish our brain. The external carotid is kind of veering forward here, supplying our teeth, our face. So the internal carotid will enter the skull through, I'm going to shrink this picture just a little bit so we can read this slide. It enters the skull through the carotid canal, and it supplies the brain and the surrounding structures. It runs slightly lateral to the external carotid artery. And here we can't really see that dimension. We're kind of looking at it as like a superior or a posterior anterior view here. If we were looking at the person straight on at the nose, you would see that the internal carotid artery is a tiny bit more lateral than the external. And the external carotid, it's our main source of blood for tissues of the head, and it has those 8 branches that we talked about. So let's take a closer look at each branch. So superior thyroid artery. It's the first branch to leave the external carotid, and it supplies the thyroid gland and muscles of the larynx. So that kind of makes sense. Superior thyroid, okay. It supplies our thyroid and the muscles of the larynx. The lingual artery. It leaves the external carotid at the level of the hyoid bone. It runs forward and upward to the floor of the mouth, and it ends at the tip of the tongue. So it has the lingual artery then divides into the sublingual, the dorsal, and the deep lingual. And the lingual artery supplies the sublingual and submandibular glands, the floor of the mouth, the mandibular lingual gingiva, and the tongue. And this is with blood. We're talking about blood. We're not talking about nerves. We're talking about blood here. So that's what it's supplying. The lingual artery, if you have your tongue pierced and they unfortunately get a portion of the lingual artery, the tongue will bleed like crazy. It's a mess. So here is a kind of a closer view of our lingual artery. Here it is, it's branching here. Here's our internal carotid, here's our external carotid. Here's the facial artery going a little above. Here's the lingual artery branching off, supplying our tongue, our submandibular gland, our sublingual gland, floor of the mouth, all with blood. So our facial artery leaves the external carotid just above the lingual artery. I'm just going to go back here. So here's the lingual and here's the facial artery leaving the external carotid artery. So it crosses the mandible at the notch anterior to the angle. So we have like a little notch, and sometimes when you're feeling the submandibular glands, you feel for the notch first, then you hook your fingers underneath. Sometimes you can feel a pulse there. And the facial artery will actually end at the canthus at the medial corner of the eye. And it supplies the superficial structures of the face. And the facial artery has some communication or an anastomosis with the ophthalmic artery. And it connects an internal with the external carotid artery supply. And this will be important later on when we're talking about some problems that can develop when you have something, a lesion on your face, and how it can spread. So let's see here. Facial artery, here's our lingual, and then right above we have our facial artery. And then the facial artery breaks into a lot of different little arteries, the ascending palate, the submental, anterior labial, superior labial, and angular artery. You don't have to know those. And then we have some other branches of the external carotid, the occipital, the posterior auricular, and the ascending pharyngeal, which we don't have much to do with. That's like back of the head, behind the ear, and the throat. So we won't be, as hygienists, dealing with these branches of the external carotid. And then finally, we have some terminal branches of the external carotid artery. And at the level of the parotid gland, so now we've come up more, right? We're at the parotid gland. The external carotid will divide into two terminal branches, the superficial temporal and the maxillary. So first we'll take a look at the superficial temporal, and then we'll look at the maxillary, because that division of the external carotid artery is really important to dentistry. So first, the superficial temporal. So this will supply the parotid gland and in the scalp, the TMJ with blood. And sometimes you can actually see it on someone if they have like a Whipple haircut or they don't have hair. You can see a pulse right near the temporal region, and this is the superficial temporal artery that you can kind of see throbbing in someone's head. And then the maxillary artery. So you know how we talked that there were 8 divisions or branches of the external carotid? One of them being the maxillary artery. Well, the maxillary artery has 15 branches. What? Well, we need a lot of blood in our head and neck and teeth. And the maxillary artery is the most important one to dentistry. It supplies the muscles of mastication, our chewing muscles, our teeth, our oral cavity, and our nasal cavity. And there are 15 branches. So this is where it's a little different than the nerves, because we're kind of used to thinking of V1, V2, V3, with V1 being the maxillary division and V3 being the mandibular division. That's nerves. Now we're talking about arteries. And the maxillary artery, the branches it gives off, some of them go to the mandible. So let's take a look at these 15 branches. All right, so it's external carotid, so we can say aorta, then we can say common carotid, then we can say external carotid, then maxillary, and then that further divides into the middle meningeal, the inferior alveolar, so I'm thinking, I bet that goes right down there to the mandible, the deep temporal, the pterygoid, the mesenteric, the buccal. I bet there's some muscles that's going to the posterior superior alveolar, the infraorbital, the greater palatine. Bet those are some maxillary teeth, and the sphenopalatine. I bet that's the palate. Let's take a look. Oh, so here we go. We have, so here is our parotid gland, and here is our maxillary artery giving off all of these